Hi, I'm Dr. V K Chaitanya Rao, your sinus doctor. I've performed more than 10,000 nose and sinus surgeries to date, and every time I go to visit my patients in a post-operative ward, I keep hearing about the same misconceptions about the recovery after sinus surgery again and again. Today, in this video, I'm going to address these common misconceptions about the care required after nose and sinus surgery. The first common myth most of the patients have is that their nose should be packed after the sinus surgery. Like I told you already, in my past more than 10 years of experience having performed numerous surgeries, the need for nasal packing in these patients is very less. I can say in every 1,000 surgeries I do, I may be packing maybe 1 or 2 nostrils. Most of my patients and their attendants keep asking me, can we chew on hard foods after nose and sinus surgery? Yes, you can. You can have all kinds of food from the next day of your nose and sinus surgery. You can chew on hard foods, and you chewing on the hard foods is not going to cause any damage to the operated nose and sinuses. We advise to avoid cold foods, foods which may be causing allergy for you even before your nose and sinus surgery. And also we ask the patients to avoid very hot foods. The next common myth is that the patient should avoid having citrus fruits or dal items, that is lentils, after nose and sinus surgery. This is again totally not true. If you're not allergic to citrus fruits or if you're not allergic to lentils, you can consume them in normal quantities just like before the surgery. And you having the citrus fruits or not, lentils is not going to cause a bad healing of your nose and sinuses. The next common question I get is, can they touch their nose or can they wash their face after the nose and sinus surgery? Yes, you most certainly can. You should wash above your nose well. If you don't wash above your nose, a lot of pimples will start appearing above your nose. Some of my patients I see on the 10th day post-operatively, they get a lot of eruptions all over the face and nose. And when I ask what happened, they keep telling me that since you have done a nose and sinus surgery for them, I thought I should not touch my face or nose. That is totally untrue. You should wash your face and nose. The only advice is that you don't push on your nose too much after your nose and sinus surgery because it's going to be very painful. The next common question I keep getting is that they should take complete bed rest after the nose and sinus surgery. Except on the day of the surgery, you can start doing your normal activities from the next day of surgery. You can drive on your own, you can go to your office on your own, you can do your normal pace activities as usual. You cannot indulge in heavy lifting, you cannot indulge in activities which is going to cause a lot of exhaustion for you. But rest of the normal office activities, household activities, you can take over from the next day itself. Next common question I keep getting asked is, should the patient wear the mask at all times after nose and sinus surgery? And that is not required. You can do your normal activities. If you're going into a very dusty environment or if you are going near people who have cold and cough, it is advised that you wear a mask. But otherwise, normally, you can keep breathing through your nose without wearing a mask. The next common question I keep getting asked is, since I've operated on the nose and sinuses, can the patient breathe through the nose? Yes, they most certainly can breathe through the nose after the nose and sinus surgery. The patient will definitely feel some form of a nose block and he may not be able to breathe completely through the nose when he has to compensate by breathing through the mouth. He should not forcibly blow his nose or pull back his nose after the nose and sinus surgery, but he most certainly can breathe whatever he can comfortably through the nose and sinuses, and this is not going to hamper his healing in any way. The next common question I keep getting is, can they move their head here and there? Can they sleep on the right or left side? Because in that positions the nose can touch the pillow, and will that cause any injury to the nose? The patient can most certainly turn his head all around. He can sleep comfortably on his back, he can sleep on his left or right. Even a little bit of touch on his nose, nothing will happen to the corrected nose and the sinuses. The next common question I keep getting asked is like the old one, should they have complete bed rest? Is exercising off limits after nose and sinus surgery? You can do normal walks at a normal pace after sinus surgery. It is advisable that you don't run or participate in the outdoor sports activities at least for a month after the nose and sinus surgery. So yes, you can exercise, but at a very low pace after the nose and sinus surgery, at least for a month. The next common question I keep getting asked is, should the patient stop all his regular diabetes, hypertension medication, since I'm going to prescribe some medication from my side for the recovery of the nose and sinus surgery. No, you should not stop your regular medications. You have to take your hypertensive medications. You have to take your diabetes medications. If you are a patient who has hypothyroidism, it is advised that you do take your thyroid medications also. But if you're a cardiac patient who is on blood thinners, your anesthesia doctor, your ENT doctor will advise you when to start resuming those medications post-surgery. So it is imperative that you take your regular medications as usual. If you have any doubt regarding that, ask your ENT doctor, ask your anesthetist, and they will guide you very well. So do not stop these medications without taking the prior permission. So I hope I'm able to convince you regarding some of the misconceptions most of the patients have post-sinus surgery. If you have been delaying your sinus surgery because of these misconceptions, please be rest assured you can go ahead with your nose and sinus surgery. If you still have any doubts, please ask in the comment section below and I'll be happy to reply to all of them. Thank you so much and namaste.